Ladies and gentlemen, welcome back to KAREEM'S Clinic, a place where you obtain all the information about your health issues. Today, I want to go straight away to vaginal discharge. Note that throughout the video, I will refer to the vagina as the birth canal. Now, what is vaginal discharge? That is one question that a lot of women ask themselves. Why vaginal discharge? Is it normal? Is it abnormal? There are women who see this discharge forever. There are those that do not see this discharge at all. But in one way or the other, a woman has to see some discharge. This is what it is. Vaginal discharge is normal, extremely normal. The vagina is an organ that is self-cleaning. In other words, the vagina cleans itself. You don't need to clean the vagina, it cleans itself. The vaginal discharge that we are talking about is just a fluid. This fluid comes from up the vagina. All these are dead vaginal skin cells. The bacteria, the dead bacteria, the bad bacteria from the cervix coming all the way down so that the body gets rid of them. So it is normal that you have a discharge, because with the discharge, then your vagina or your birth canal will be getting rid of the germs and the dirt in it. This will help the urinary tract from being infected. Also, it is a way of lubricating the vaginal tissues to make it clean. Now, it is important to note that in as much as the vaginal discharge is normal, there are things that you will find abnormal. What is the color of the normal vaginal discharge? Normal vaginal discharge should be white, the egg white. Remember, there is another white. We are talking about the egg white. 100% normal discharge is clear. If you have a clear discharge, then we say that is a very normal discharge. So you shouldn't get worried about your discharge. Why do I have it? How can I make sure that I don't have it? No, it is normal. Just have your panty liner on. Make sure you keep yourself dry using a panty liner so that you don't soil yourself. But a vaginal discharge that is clear is very normal. When should I get worried? Somebody is asking when they should get worried. Yes, if we are supposed to be real, at one point or moment, you have experienced a difference in color of your discharge. Sometimes you get into the bathroom, you pull down your pants and you realize the color is not usual. What do you do next? You need to find out what that color is. And once you find out the color, then you need to know what that indicates. Vaginal discharge that is colored has a different meaning. The meaning is not quote unquote normal. It is abnormal. When do we have clear discharge? When everything is okay, we say you have a healthy discharge. That healthy discharge is clear. That is number one. Number two, clear discharge also will come when someone is pregnant. During pregnancy, you realize you have clear discharges. That is normal. During ovulation also, we see clear discharges. and also clear discharges could mean that you have hormonal imbalances, not an infection. What about white? When the white is egg white, normal, without any bad odor, without a smell, then we say that is also a healthy discharge. It is that is normal. A yeast infection comes in when the white is too much and there is an odor. That is the difference. There is a smell, probably a smell that is not normal. Remember, the birth canal has got the natural smell. That natural smell is known by the owners. So once you realize the smell has changed from the normal smell that you are used to, then there is a problem. If the color is white and the smell is not normal, then you could be suffering from yeast infection. Now, yeast infection has some other symptoms that probably we'll talk about in a different video. The next thing is, what about pink? When do we say the pink is normal or the pink is abnormal? Now, the pink is never normal. Anytime you realize you have a pink discharge, then it's just normal that we say you have a bleeding. Pink actually means blood. So that means you could be having a vaginal irritation. Also, the pink is the point at which you now start to discover the cervical bleeding. And when you have a cervical bleeding, that is very, very serious. It means you could be having cervical cancer. And I don't mean you must have, because pink could also mean you have bleeding, implantation bleeding. So the moment you realize you have pink, do something. Don't just sit. Go visit a healthcare provider so that they find out what your pink means. Could it mean cervical cancer? Or is it cervical bleeding? Or is it just a normal vaginal irritation? Of course, I said normal vaginal irritation, but vaginal irritation is not normal. You still need to find out what the problem is. And that throws us straight away to pink, to red, sorry, or dried brown. Now, red means menstrual cycle. That is what we are used to. During that time of the month, you realize, you see red, you realize you have menses. That is normal. And that is the first meaning of red. However, when this red comes when you are not in your menses, then it means a different thing altogether. Now, that could confirm cervical cancer. This red again could confirm a cervical infection. So it evolves around, revolves around cervix. So we have the cervical infection. You could have an infection, either bacterial infection of the cervix. You could also have what we call a cervical polyp. So red is also very, very serious. You need to take it very, very seriously, especially if it is of your menstrual durations. So that is very important to note. The next color that I want us to talk about is yellow, green. Yellow, green. Yellow, green means you have sexually transmitted infection. That is very much important. When do we talk about sexually transmitted infection? Now, Any sexual transmitted infection, the discharge will always be yellow towards green. These infections should be checked very thoroughly. Why am I saying this? Sometimes it takes time for you to realize that you have an infection. Sometimes you could be having an infection and you don't have the symptoms of that infection, especially for the women. Infections like the gonorrhea. In Nairobi, like for instance, we have had super gonorrhea. In the US, there was also super gonorrhea. There was also, I remember there was a disease, there was a bacterium from a group of the Klebsiella group that attacked USA. So the moment you see yellow to green, then automatically that means you have an STI. So you need to go for checkup. STIs, as I've said, could be gonorrhea, chlamydia, just to mention but a few. So that is very important for us to know. So those are the major colors of the vaginal fluid, or the fluid that comes from the birth canal. We are going to look at those STIs specifically and look at their symptoms and look at how to bring them to an end. But the big question is there anything that I can do to stop my discharge? If you want to stop your discharge, the bad discharge, then keep the birth canal safe. That means don't wash it with soap, any detergent. We have these sprays that ladies do spray down there. We do not allow those sprays. Why? Because the moment the sprays get there, they interfere with the normal ecosystem within the vagina. Let me explain this. Within the birth canal, we have good bacteria. We call them the flora. The good bacteria that give the birth canal that natural smell. These good bacteria also protect the vagina from getting infections. So once you wash the birth canal using soap, definitely you will interfere with that ecosystem. Now, due to that interference, chances are you could receive discharges in plenty. So when that happens, you want to be comfortable. There are those who use pessaries, too much of pessaries. Again, you interfere with that normal environment, which you should interfere with. The last color that we want to look at here is the gray color. If you have a discharge that is gray, then you have what we call a bacterial vaginosis. Bacterial vaginosis is an overgrowth of the normal bacteria. So that normal bacteria, the moment it overgrows, then you'll have to discharge gray. Now, sometimes you could ask yourself, do we also pick this from sex? This bacteria affects those who are sexually active. However, it can also be obtained without having sex. So if you want to know that this gray color is for BV, then you will always have more discharge than usual. You know, gray is towards colorless. So it would be very difficult for you to know that it is gray. But the moment you realize the discharge is more, and then you have itchiness and burning sensation, then automatically that means you have BV. Therefore, what are we talking about here? We are talking about the color of the discharges. When is it normal? When is it not normal? So it is upon us to take good care of ourselves and also get to know all these colors, know when to visit a healthcare provider. If you have any questions, I will provide my email down on the link so that you get to email me and ask me whatever questions you want to ask. That is all we have today. I would thank you so much for choosing KAREEM'S Clinic. Consider subscribing if you benefited. Thanks.